Welcome back to the MedEdit podcast, your go-to source for evidence-based medical education.
And the only podcast where two board-certified physicians interview specialists on the topics that you care about. This episode, we're bringing awareness about hepatitis for Hepatitis Awareness Month. What is hepatitis? What causes it? And can it be treated?
The second half of today's episode, we have our favorite segment, Celebrity Hype. Eric Dane, best known for being McSteamy on Grey's Anatomy, recently revealed he has ALS. May also happens to be ALS Awareness Month, so we wanted to give you the facts about this tragic disease.
Let's get started. We're your hosts, Dr. Cari Sorrell
and Dr. Jessica Gray. Welcome to the MedEdit podcast. Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the MedEdit podcast.
As we mentioned, May is Hepatitis Awareness Month, something that I see all the time. Pretty much every time that I work, I'm getting called about a patient with hepatitis. A lot of people do not know or understand that there are actually several causes for hepatitis, and the cause sometimes determines the available treatments.
Dr. Sorrell, let's just start with the basics. What is hepatitis if you're tuning in for the first time and never even considered what that would be?
Right. So hepatitis is really just a general term that means inflammation of the liver. It can be caused by many different factors, including viruses, the use of, I would consider toxins, because alcohol, I kind of consider a toxin, other toxins, certain medications, and sometimes autoimmune disorders as well. The liver it's a vital organ because it's responsible for filtering our blood, detoxifying chemicals, and producing proteins that are important for us to be able to clot our blood. And also it's important in digestion.
So liver is extremely important.
Yes,
That's
it
why
is.
we want to take good care of it. And so, when it talks about hepatitis, what are the common types of hepatitis?
Well, viral hepatitis, which of course is caused by a virus, is a very common cause of hepatitis worldwide. So we'll start there. The World Health Organization estimates that, in 2022, about 1.2 million people were newly infected with hepatitis B virus.
That's interesting.
I know, right? And 1 million were probably newly affected with hepatitis C virus. So that's a class of viruses that like to target the liver. Approximately probably 250 million people have chronic hepatitis B, and there's probably currently maybe about 50 million people who have chronic hepatitis C. These are the most common viral types, but there are some others as well that we'll talk about. And I mentioned that in general, these hepatitis or these type of viruses, there's probably 5 different subtypes within it. And so hepatitis A through E, basically. We kind of mentioned that B and C tend to be the ones that we worry about the most, because when you talk about chronic hepatitis, that tends to be the cause if it's going to be a viral hepatitis. Hepatitis A, which actually has been in the news quite a bit recently. They just had an outbreak, I think, in Los Angeles, maybe.
There's always an outbreak
There's always
somewhere.
an outbreak somewhere. And that's spread through contaminated food or water. So that's like that fecal oral route. A lot of times if you go to certain parts of the world and they tell you don't eat or drink certain foods or drinks, a lot of times that's because they worry about hepatitis A contamination. Fortunately, it's usually short term and resolves on its own. Of course, if somebody has underlying medical conditions that can affect them more severely, and there is a vaccine, and that's actually part of our recommended routine childhood vaccine as well.
And that's a newer one,
Yes, it is.
Not necessarily new, like, my kids were the first ones to get it type of new. No, like I remember specifically me being one that it was optional, hepatitis A, like when I was a young kid. And so when you're listening, if you're like, I'm not sure if I got my hepatitis A vaccine, there are ways to check for that antibodies, but also, it depends on your age as well. If you're probably above 40, that may not have been as routine, but it is now. So you don't have to worry about your kiddos not having it, that have the routine vaccination.
And I think a lot of that too is because probably when we were younger, even before, there wasn't as much like transit of people, and travel, and people moving, country to country. I don't think it was as common as we've had more of an influx of an immigration population or immigrant population who may be carriers of hepatitis A. I think that's, or even just people traveling more. I think it's just why it's been more of a recommendation, because we see that.
Yeah, it's definitely, obviously, hepatitis A is one of those, like you said before, ones that necessarily is going to become chronic and cause you to have liver failure. So if somebody says, oh no, I was diagnosed with hepatitis A from some kind of exposure route, a restaurant, even they have outbreaks of those all the time. They don't have to think that, oh my goodness, now this is some chronic disease that I have. Most people pass it self-limited. you're great, but it can cause major things like dehydration,
Sure.
issues with your, like your liver enzymes itself, but also the side effects of like, having, the diarrhea or nausea, vomiting, and all that stuff too.
Yeah. And it said it can acutely be pretty severe, but I've probably only seen that maybe like twice in my career thus far that I've seen that. Usually somebody traveling from another region that got infected with it. And there's hepatitis B, which is one we hear about more, especially outside of the United States. It's not as prevalent inside the United States, but extremely common in like Africa, Asia, places like that as well. And that's spread through contact with infected blood. So it has to be blood contact, sexual contact, or from mother to baby, because that's a fairly bloody experience at times, during childbirth. And that can be acute or chronic, which chronic would mean that your blood work shows that you are still carrying that virus more than 6 months after your exposure. Again, a vaccine available for hepatitis B. And I feel like in general, when we were younger, it was more of just if you did certain jobs that it was recommended, like because we were in the medical field, they're like, yes, you need hepatitis B vaccine. But as you mentioned with hepatitis A, becoming much more of a universal recommendation.
Yeah, absolutely. And then Hep B, remember, that's the one that we give to babies when they're very, very young. It's extremely safe. And some people will ask, well, why are we giving them hepatitis B vaccine when they're itty bitty and they're not necessarily, working in the medical field and going to get a needle stick exposure, or they're not obviously partaking in sexual intercourse? And we say we want to vaccinate for these very, very serious diseases well before anyone's ever even has a chance to be exposed. And that's why we start that so young.
Yeah. And also it helps. And it's one of the things when you talk about like why we do research and why modern medicine is so helpful is that one of the reasons we have such low rates of chronic hepatitis B in the United States is because it is something that pregnant mothers are tested for, so they can be given things at the time of delivery or before delivery, which decreases that risk of transmission to their baby. Because in most parts of the world, that's actually the most common reason that you see it. And the younger that you get infected, the more likely you are to get chronic hepatitis B. Next, we have hepatitis C, which is again spread through blood to blood contact, like sharing needles, for example, in addition to the other things we've already talked about. And that does very often become chronic compared to some of the other ones where you tend to clear them. And there is no currently a vaccine for hepatitis C, which I feel like is something we probably will see in our lifetime, but there are very effective treatments that are available, which is something that has changed even in my short career thus far of a decade, something that has gone from a very painful, long treatment to something that can be treated with a once-a-day pill for as short as 4 weeks. So again, a marvel of modern medicine.
Amazing.
And these medications. So that Hep C is probably the one I see the most. And that's, a lot of times because it does cause chronic disease. And there is also hepatitis D, which can really only occur in what we call a co-infection. So people who have hepatitis B as well, and it kind of go together. And a lot of times what it does is just amplifies that hepatitis B infection. So it just makes it more worse if you also carry hepatitis D. And so again, because they're co-infections, rates of that generally decrease when there's high rates of vaccination for hepatitis B. And then lastly, for hepatitis E is the last one, which is through contaminated water as well. And for most people, it usually is acute and resolves on its own. The patient population we really worry about getting hepatitis E is pregnant women, because it tends to be a very susceptible time that they actually, I've seen this happen, of women having acute liver failure because they contacted hepatitis E while they were pregnant. So that's generally that population we worry about.
So who's at risk for getting these viral types of hepatitis?
Well, hepatitis A and E is going to be basically anybody who's exposed to contaminated food or water. So if you're in a region that's more common, or if you just happen to eat at a restaurant and somebody didn't wash their hands well after going to the bathroom, then you can have contaminated water or food. And general exposures, again, rates are higher in like Africa, Asia, Central and South America, and even Eastern Europe, which is somewhat related to just sanitation. Anyone can get hepatitis B, but high-risk people would include people who inject drugs or share needles or just syringes for another reason, even if it's not for drug use.
Like diabetics.
Yeah, like diabetics, exactly. Drug equipment, which because of the opioid crisis, basically, we're saying that paraphernalia that people are using where they could have a small cut in their nose, or because they're using a needle or something like that, and they share with somebody else. Infants of infected mothers, sex partners of infected people, especially we see just higher rates in men who have sex with men, people living with someone who has hepatitis B, because of course you're more likely to have a close contact blood exposure, healthcare, public safety workers, again, if you're exposed to blood, hemodialysis patients as well, because that is part of the exchange that they do when they do dialysis. And then people have actually gotten it with tattoos as well from infected needles, although that is, something that we don't see as much anymore, but definitely a risk factor. People at risk for hepatitis C include kind of the same thing: current or former drug users, even if it was once many years ago, people with HIV, people who are on hemodialysis, again, multiple sex partners as well, organ transplants recipients, really kind of before when we were young. So before 1992, with blood transfusions or organ recipients is really when you saw that, or even certain blood factors in the 80s. That is actually something screened for, though, when you donate blood, is hepatitis C as well. So I've actually had several people who that's how they have found out, because as we'll talk about, you may not have symptoms just because you carry the virus. And because of, again, things that we research and we learn, universal screening protocols have been put in place that have improved diagnosis and treatment in asymptomatic patients. So generally anyone over the age of 18 or under 18, if you have known risk factors, should be screened for hepatitis C at least once. And if they have that risk factor again, they should be screened again. And this, as we mentioned before, includes pregnant people. And if you have ongoing risk factors, then you should periodically get tested.
Yeah. So that's one of the things that if you ask for STD screening in your primary care setting or OB-GYN, they can do some of the more popular, obviously, STD screening, like including chlamydia, gonorrhea, hepatitis, HIV, but they can also include hepatitis on there, and they can do a panel as well. And so oftentimes that one gets left off. And so I think you can definitely ask for that, because not only is it STD screening, because yes, some of these can be transmitted sexually, but also it's just good to know for that whole screening person for the general population, like she talked about.
Yeah.
So what are the symptoms of hepatitis? And again, we're still talking about viral hepatitis. So what are those symptoms?
And in general, like many causes of hepatitis kind of have the same symptoms, which is what makes it a challenge. And a lot of this stuff is diagnosed either through blood work or biopsying a sample of the liver. So it's going to be vague things like fatigue. It could be nausea or vomiting, abdominal pain, especially when we talk about in the right upper portion underneath your rib cage. You can have a loss of appetite. Sometimes you'll see changes like the urine getting darker because, again, you have higher concentrations of bilirubin. Same thing happens in the stool. That's why it's more pale. You can have jaundice or yellowing of the eyes and skin. But more than half of people with hepatitis don't know they have it, and they don't have any symptoms, which is why it spreads so easily.
Is there a treatment for viral hepatitis? I know you touched basic treatment options for Hep C, but let's say you're talking about Hep A and E and all of those other ones.
Yeah, for some there are. Hepatitis A and E you don't really treat. You just kind of support in the acute period for whatever your body is experiencing as a side effect of having the virus. You can suppress hepatitis B, which does decrease complications, decreases risk of liver cancer, decreases progression to cirrhosis. And the real marvel, of course, we've talked about before, is treatment for hepatitis C, which has been revolutionized in the last 10 years. So we have what we call direct acting antiviral or DAA medications that are highly effective in treating hepatitis C. And we have cure rates over 90% in most patients. This is the road to this public health success story started a very long time ago, actually back in the 70s when this was first isolated in the blood, and they were trying to figure out why certain people who got these products got jaundice. Well, they finally realized back then that they were transmitting hepatitis C. So then once you found it, which led to a Nobel Prize in 2020, then they got really good at going all the way from screening for it to treating it.
That is amazing. I remember being in medical school, and that was just coming out, them talking about making it more readily available, especially in the healthcare worker setting where they're
right.
I mean, I have had a needle stick, and I have actually had a needle stick with a Hep C positive needle. And so, thank goodness I didn't actually develop Hep C and all that stuff. And we had to do all those testing and all that really scary stuff. But as you sat there, you're like, thank God for the guy that invented this stuff.
Oh yeah, absolutely. It's amazing. I mean, even when I started residency and very, very early on in training, they were still using interferon, which you hear of. And that was brutal. That was a really brutal treatment. A lot of people fell out. It was not highly successful. And the complications were very high, and people a lot of times didn't finish it. So it is pretty amazing.
So we also know that another common cause of hepatitis is alcohol. So tell me more about that.
Yeah, something I also see every single day. And alcoholic hepatitis, again, is inflammation of the liver caused by excessive and prolonged alcohol consumption. It can range from being somewhat mild to even be life-threatening. And it's kind of a spectrum. So it's like alcohol-related liver disease, which includes all the way from just having some fat in the liver, which is early stage, reversible. Your liver does a really good job of healing itself. You can have acute alcoholic hepatitis, and then you can also have all the way to cirrhosis, which is when it's scarred, which is not reversible.
So who gets alcoholic hepatitis?
Yeah. So generally you'll see it in chronic heavy drinkers. So most commonly people who drink heavily over many years, although not everyone, interestingly, who drinks heavily gets it. So there is a lot of genetic predisposition to some people getting it and some not. Binge drinking also can trigger it, even if you haven't had a lot of years of alcohol abuse. So it's kind of a cumulative effect.
Mm-hmm.
Even like I said, not every heavy drinker ends up with it. So there's a lot of other things that go into it, probably besides genetics, nutrition. There's some gender vulnerability, certain ethnicities, things like that.
Symptoms are similar to viral hepatitis, right?
Yes, they can all look similar, and there's no like one great single test, but it's really a diagnosis based on a combination of your history of heavy alcohol use, your physical exam, and symptoms. Of course, we get blood tests, which there's certain trends that we see in that blood, which suggest alcohol is the most common etiology. And then, of course, imaging is part of that, and sometimes biopsying or sampling the liver is needed.
So for alcoholic hepatitis, can you treat it?
So of course, the mainstay of treatment is stopping alcohol. It's basically like a fire. You put water on the fire, you douse it, the water goes out, right?
Mm-hmm.
And so if you do that before you start accumulating scarring on the liver, then you prevent getting cirrhosis, which is when you start getting a lot of complications. Whatever resource you need to do that, the data that we have that's really good includes Alcoholics Anonymous, medications that also can be helpful in helping people quit. And of course, when the liver is acutely inflamed, we do have some treatments in a very monitored setting that you may qualify for.
So, and those are things that you can start by talking with the primary care physician about. You can talk to a GI doctor if you're already at that level, but these are conversations that need to be open and definitely had.
Sure.
To round out our most common cause of hepatitis, though, so we talked about alcohol, we talked about viral. Those aren't the most common cause, especially here in the United States.
Not anymore. Not anymore.
Sadly. So we're going to talk about something called MASH, which, by the way, is my favorite little acronym to pick out there. So MASH, M-A-S-H, metabolic associated steatohepatitis.
Metabolic dysfunction-associated. Yeah, steatohepatitis.
Mm-hmm.
Yeah, which is our fancy new word for NASH. We like to have a lot of acronyms for things. And basically, as just mentioned, MASH which was previously known as NASH. Kind of in 2023, they changed it to better reflect the role that metabolic dysfunction had in the formation of this disease, because really before it was just non-alcohol. So it's like, okay, you're not a drinker, this is what you have. But really with the obesity crisis and, metabolic syndrome and all these things becoming more prevalent, it needed a name update. And it's a mouthful, but that's why we're going to abbreviate it here as well. And so basically it's related to having metabolic syndrome and obesity causing liver disease.
So who's at risk for MASH?
So really anyone with obesity, type 2 diabetes, insulin resistance, kind of the same thing we see with high cholesterol or triglycerides. If you had high blood pressure, and there is some correlation too with like polycystic ovarian, which I know is a little bit of a complicated correlation. And then of course, sleep apnea as well. So those are all risk factors, kind of the same risk factors we see with all obesity related diseases.
Is there a treatment for MASH?
So it's a very hot area of research. Unfortunately right now, mainstay of treatment is still lifestyle modification. Even a 7 to 10% weight loss can actually significantly improve inflammation and reduce the likelihood of scar tissue. It does not have to be dramatic. Exercise helps as well. As we've mentioned 18,000 times on this podcast already, a Mediterranean diet with low sugar, low refined carbs is helpful.
So not the carnivore diet.
Exactly. No, I wouldn't recommend that. Yeah. And then of course, if you can control your risk factors, if you can control diabetes and high cholesterol, GLP-1s are hot for this right now as well, which again, really is just weight loss. Whatever method you use to do that is going to have benefit. And we've looked at in current research on medicines that specifically target the liver, and then just in general medications that help you lose weight.
So why is hepatitis as a whole so serious? Why are we even talking about this? Why is there a month dedicated to talking about this?
Well, if you get inflammation of the liver long enough, you can get something called cirrhosis, which is when you have a lot of fibrosis or scar tissue, and it has a lot of complications. I mean, that's what I see like probably 50% of my practice and most GI doctors do. And at some point your liver just really stops being able to work because all of the healthy tissue has been replaced with scar tissue, and that's called liver failure. So it can affect your kidney function as well. They can get things called encephalopathy, or they can get confusion. They're also at higher risk for liver cancer. So we have to start screening for that as well. And unfortunately, once you get to that point, really the only cure is a new liver or a liver transplant, which if you're really, really sick, it may not have enough time to get to.
Yeah. And unfortunately, working, we both worked in the hospital, seen these patients. I've seen it from the clinic settings as well.
Right.
So it's just really sad. And there's some patients who can go many, many years and never develop like the actual liver failure portion of it. They just have this, the fatty liver disease, or they might have the inflammation, or they may even have the cirrhosis, but then some that can progress really quickly. And so that's the thing, is you don't know which category you're going to be in. So why not stop something that has a progressive pattern and stop it before it does progress.
Yeah. I mean, I've seen people ranging from their mid-20s to their 70s when they first have their complication of cirrhosis. So it's not, you don't always know if it's going to be something that won't catch up to you till you're older.
Yeah. I had a young alcoholic hepatitis patient in his young 20s not that long ago. And it was a really sad case, but well, that was a very thorough review of hepatitis. Remember, talk to your doctor about screening recommendations. And if you have any potential exposures, habits, symptoms that may indicate you need additional workup, or just start that conversation.
Absolutely. And there are some causes we didn't mention. Like I said, there's a million different things we could talk about, like autoimmune disorders and that stuff. So we just covered kind of the main players today. I don't know if there's anyone who has never seen an episode of Grey's Anatomy for how long it's been on TV. And if you have, you've probably heard about Dr. McSteamy, played by the very handsome Eric Dane. And he is the topic of today's Celebrity Hike segment.
Yes. Dr. Mark Sloan. How could we ever forget him?
Yeah, sadly, he recently told media outlets that he has been diagnosed with ALS, or Amyotrophic Lateral Sclerosis, also known as Lou Gehrig's disease. And since May is ALS Awareness Month, we wanted to review it here.
So ALS is a progressive neurodegenerative disease. It affects the motor neurons, these nerve cells responsible for controlling those voluntary muscle movements. When we talked about muscles, we talk about things that are voluntary and involuntary. Like your heart is more of an involuntary muscle. You don't have to tell your heart to beat. But when those voluntary muscle movement, that's more like, okay, I tell my arms to move, my legs to move, my head, all of those things. Even can affect things like breathing. So as these motor neurons die and scar due to the ALS, muscles then weaken and they can lead to paralysis and eventually death, and usually due to respiratory or lung failure, again, because that's how that muscle gets too weak to control that breathing pattern that you need with the diaphragm. It is a very, very sad disease as well. And again, that word progressive that we talked about, it means that we just kind of know the pattern. Unfortunately, know what's coming.
Yeah. And I think the scariest part is, you may ask, well, who's at risk for ALS? But most cases are truly sporadic, 90 to 95%, meaning there's not a clear family history, which it makes it difficult to predict. Very, very few of them are actually due to what we call familial ALS, which is an inherited mutation.
And that is interesting. And I know this personally because I had a friend through college and I knew her afterwards that her family did have the inherited mutation. And so there are some things that you can look for, test for. And even if you're considering, family planning, there's some things you can even look at as far as, IVF and things like that. So it is definitely a conversation to have with your doctor in detail about your family history and things you may be concerned about. But usually the symptoms start subtly and they just worsen over time. Early signs depend on which muscles are affected first. Muscles can have this just weakness of the hands, arms, the legs, sometimes slurred speech or difficulty swallowing. There's muscle twitching, cramping and stiffness, weak grip, or frequent tripping. I definitely know that this is on one of my differentials every time I have a patient come in with some of these interesting symptoms. And so, we don't want to go looking for, what do we say? When you hear hooves, you don't want to think zebras, you want to think horses, right? This would be more of a zebra because it's not that common, but you do want to keep it in your differential. I had a patient with muscle twitching a couple months back, and man, we did a huge workup because that was what I was most concerned about. And thankfully it was not ALS, but the reason why we care is because these symptoms do seem benign at first, and then they do progress. You can eventually see difficulty walking, trouble speaking and swallowing, and eventually trouble breathing. They can get involuntary, kind of some laughing and crying. This is called a pseudobulbar affect. Cognition is usually preserved. So that means that usually you know what's happening. You're not having like the dementia-like symptoms. But 50% may develop those cognitive behavioral impairments, and about 10% do develop frontotemporal dementia, which I've had a few of those patients with that specific kind of dementia. And it is a difficult diagnosis.
Oh, for sure. And there's no single test for ALS. It's diagnosed really based on clinical signs and ruling out a lot of other conditions. Certain tests that do help are electromyography or EMG, nerve conduction studies, sometimes an MRI to exclude, other conditions like you mentioned, and, blood and urine testing to look for other things, and sometimes genetic testing if you do suspect there's familial cases.
And sadly, there really is no cure, but we do have FDA-approved treatments which can slow progression and improve that quality of life. So that's really important. And we wish, Eric Dane the absolute best and send him our love from fans, of course. But that is a wrap. If you're a listener claiming CME credit, please check the show notes for instructions.
And for everyone tuning in, please don't forget to subscribe, follow us on Instagram and TikTok, and let us know what other topics you'd like us to cover. We'll see you next time on the MedEdit podcast.
Thank you for listening to the MedEdit podcast. Please click the follow button to be notified when more episodes become available. For more information about this episode and to find out how you can reach Dr. Cari Sorrell and Dr. Jessica Gray, please visit today's show notes. Be sure to follow us on our socials, Facebook, Instagram, and TikTok to stay up to date on all things the MedEdit podcast. The information and content has been made available for informational and educational purposes only and does not constitute a physician-patient relationship. If you need medical advice or help, please contact your personal physician. The views and opinions of the guests do not necessarily reflect the views of Dr. Jessica Gray or Dr. Cari Sorrell. This podcast should not be considered an alternative to medical advice or diagnosis or confirmation of an illness or disease. Please seek help from your personal care practitioner. Thank you for listening, and tune in next time.